Hi, my name is Katie. I have lost 85 pounds using a GLP-1 and counting. And I also have polycystic ovarian syndrome. So today I kind of wanted to sit down and talk about like the reasoning why I chose to go on a GLP-1, what I had tried in the past that didn't work, and all of that. First, let's talk about why somebody might want to take a GLP-1 for polycystic ovarian syndrome. So one of the things that commonly goes along with PCOS is high insulin, right? So when your insulin is high, which is really, really common in PCOS, even in PCOS that doesn't result in like weight gain, there's lean PCOS. You can still have insulin resistance with lean PCOS. If you have high insulin, it can make it really, really difficult to lose weight. Your insulin is high, your androgens are also high, which could lead to the weight gain, but also hirsutism, which is hair growth that you get on your face, chest, back. It's just kind of like, I guess, more manly hair growth, but women with PCOS, people with PCOS, tend to get that as well. Another thing that commonly goes along with insulin resistance because of these high androgens is irregular ovulation, sometimes totally absent ovulation, and food noise, binge eating, intense cravings. All of that goes along with high or irregular insulin. So the reason that I started to consider a GLP-1 is because I had already tried several medications that were supposed to help with the insulin resistance that just weren't effective. I had been on metformin for years at the time that I first started taking my GLP-1, and I had also tried Wellbutrin and Topamax. Topamax had the worst side effects of anything I've ever taken in my entire life. I would never go back on Topamax. Sometimes I still feel like I'm recovering from the Topamax. Like, it really, really, really messed me up. Metformin, the side effects, I mean, everyone talks about it. Like, if you're on metformin, you know, like, you're probably gonna shit your pants if you take metformin. That was, like, manageable. I could manage that. However, it wasn't doing enough for me. Like, it wasn't doing enough. It wasn't doing what it should have been doing. I think that my insulin resistance was just, like, I don't know, super, like, it had evolved past normal insulin resistance, you know what I mean? So I had been prescribed Wegovy in the past and my insurance had declined it. So I assumed, like, I'm not gonna be able to get on this. But then I found my, like, new doctor who I love, and she left recently, as all of my good doctors do. They always leave, but small town problems, right? But she was able to fight my insurance and get me started on it, and then I was able to stay on it until right now. We're having some issues with insurance and things like that. I'm not going off of the medication. I am switching over to all kinds of new things. I will do a video about that separately. GLP-1s are known to improve insulin sensitivity, can reduce ovarian androgen production, obviously support weight loss. Everyone talks about weight loss. Can improve inflammation, which I think is definitely true for me. I'm way less inflamed than I used to be. And when you're on a GLP-1, you're going to reduce those insulin spikes that you get you get insulin spikes no matter what, but like with PCOS, they are spiking obviously higher than they would for a normal person. Your insulin goes down, your testosterone goes down, and then your ovulation can come back. My personal experience, I have had a late period twice since I got on Wegovy. So I've ovulated late twice. I have not missed a period. I have not had any problems as far as that goes. The only problems that I was having was when I was on birth control, and I was having really intense side effects from the birth control that I was on. But like right now, I'm telling you, I'm not on birth control, like, I swear, and everything has been completely normal since I got off of birth control. My journey has been like, I started this medicine without any birth control, and then as I started losing weight, I started really getting scared I was gonna get pregnant because this medication was so life-changing for me. Like, I didn't want to stop taking it. I didn't want to get pregnant yet. So I got back on a birth control pill. I was on it for a few months, had a lot of heavy bleeding for a very, very long amount of time. And we switched doses, we switched pills. Like I've tried every birth control basically, and at the end of the day, I just decided I would rather not be on birth control and just keep like super good track of my cycle, which I can do now because I'm ovulating normally. So that is what we are currently doing. But I will say, since getting off birth control and like while I wasn't on birth control at first, I've ovulated normally. Nothing has been weird. Like I had one period that was late, like really late. I'm talking like 7 or 8 days. And then the other one was like 2 days late. So I think technically I could say that I've ovulated late once in the past year, which is, if you have PCOS, like that is shocking. That is crazy. You're gonna ovulate late. You're never gonna ovulate. I had a doctor tell me like, it's probably gonna be really hard for you to get pregnant. And we're gonna probably have to put you on medication, which wasn't the case. I did end up getting pregnant with my current 5-year-old child within a few months of not being on birth control prior to this. But you know, it's just my periods were so weird that my doctors were like, yeah, this is gonna be really, really difficult for you. Another thing that I've seen improvement with is the hirsutism, the hair growth on the face. Acne as well. Acne is another sign of high androgens. Obviously I've got a little bit happening right now, but that's pretty rare, and I'm sure it is hormonal because my period is like actively happening right now. So there's not really a lot that I can do about that. But during the entire rest of the month, I'm pretty much completely clear skinned. As far as the hirsutism goes, mine was never that bad. I did grow hair, but it was blonde, so I can't really complain. Like you could see it in the sun and it would be like pretty bad. Right now, I think I have just like a regular amount of like peach fuzz that like most women get. I will say like that has improved a lot. The acne has improved a lot. My skin is just a lot clearer now. Another reason why I chose GLP-1 is because a lot of people with PCOS have like this problem in their brain where you don't really understand what full feels like. You don't really get when you should stop eating. This is, of course, my experience. However, I think that, you know, if you talk to enough people with PCOS, you'll probably hear that come up a few times. You get really, really strong cravings for carbs. And it's not like, oh, I could go for a sandwich right now. It's like all you can think about all day long and you need it. And like, if like you're gonna give in. Like it's just really, really hard to not give in to cravings with PCOS. And that food noise is driven by the insulin problem. Like your insulin is like, feed me, feed me, feed me, feed me, feed me, feed me, feed me. So it's a lot harder to like fight off than somebody who has like a normal brain, I guess, and can just say, why would I want that right now? Like that's not healthy for me. Like that's a bad choice, you know, like I'm not doing that. It is a lot harder because it's your hormones that are driving it and not just like your willpower or lack thereof. For me, what they did for me was make dieting like easier. It felt like supernatural. Like it felt very natural for me, as opposed to feeling like I am like clawing my way through every single meal every single day, like trying to get what I need in my nutrition and whatnot. And even before you lose weight with a GLP-1, like for me, I noticed a difference with my PCOS pretty much the first day that I took one of my shots. I noticed like I was already eating less. I know that that's not really that common. A lot of people like struggle for the first couple months on a GLP-1 before they start to lose weight. For me, it was like instantaneous. And I think a lot of that had to do with my insulin. Like once my insulin started to level out and get normal, I kind of just dropped weight like without really trying. I was already eating very healthy at the time and I was already exercising a lot at the time. So that could have something to do with it. But I believe that it was because my insulin was starting to like get to a good place. I was able to like just drop the weight like really quickly. I dropped that first like 40 or 50 pounds really, really fast. Now I did get some pretty significant side effects at first. I was vomiting. Well, I only threw up twice because the first time I threw up, I was like hugging the toilet and I like got on my phone and sent an email to my doctor and I was like, please, I need Zofran. So once I got Zofran, I didn't throw up as often. I think I threw up twice. I know I threw up twice. I was really, really nauseous the first couple of months. I did stay on the low dose for 2 months, and then for the rest of the time that I've been on it, I have gone up every month like you're supposed to until I hit 2.4. And then I was on 2.4 for a really long time, and now I'm actually going back down. I'm on 1.7 currently. And because I have to switch to a compounded version of Wegovy because of the insurance problems that I mentioned earlier, I will be on 1.4 for a little while. So I'm going down, but just like a smidgen. And then I'll probably end up going down to 1.0 eventually. For me, like my cycle's regular now. I was having extremely painful and very long periods to the point where my husband would have to call out of work because I couldn't function as a parent. So he would have to stay home with our daughter while I was laying in bed like crying and just in so much pain. I was on prescribed narcotics for period pain, and anyone who tells you that that's normal is lying to your face. I would try really, really hard not to take those because I'm not normally like a pusher of a medication, which is kind of like how you know that this GLP-1 shit is really working for me, because every medicine I've ever been on, I've never said like I want to stay on this forever. But with Wegovy, I do want to stay on it forever. I realized I was living life in hard mode, and then as soon as it became easy mode, I was like, oh my God, I can never go back to how I was. But anyway, my periods would last for between 7 and like 40 days. That was fun. And that was if I had a period as well. Like I would miss months. I would go to the doctor. I would get blood pregnancy tests done. They just said, yeah, you're irregular, like get on birth control. And birth control obviously didn't do a lot for me either. I had really significant side effects with my birth control. I think some people's bodies just aren't meant to handle it, and I'm one of those people. I tried the IUD. I was on Depo-Provera for years. I did several different versions of the pill. I never did the arm implant. I never did like a diaphragm or anything like that, but those were the main ones. The IUD just like decided to reject itself out of my body. I got pelvic inflammatory disease. I had to get it taken out in the ER. I was in pain for a year. Like the IUD definitely like never again. Since being on this medicine, I'm having normal periods. I do get like significant pain still, but I'm not taking anything other than ibuprofen or Tylenol. And the bleeding isn't as bad. Like I do still, I think, bleed pretty heavily, but it's nowhere near where it used to be. Like I'm talking like going through one Super Plus tampon in 15 or 20 minutes, having to wear a tampon with a pad, with, you know, another pad underneath it, like really, really, really heavy. I remember one time we went camping and it was cold, so I put on like 7 pairs of pants, like to try and stay warm at night, and I bled through like 5 out of 7 pairs of pants through a pad, through a tampon while we were camping. That was fun. Like that's just an example. Fatigue, I really only get fatigued right before my period now. It used to be a lot more significant than that. PCOS, you know, you just have this like constant brain fog and like fatigue feeling. That has gone away. The main reason why, when my insurance changed and they said we're not covering this anymore, the main reason why I am like still actively fighting that is because of the mental health benefits. So with PCOS tends to come depression, anxiety. My depression was pretty significant. I was on and off of antidepressants basically since I like hit puberty. I'm now currently not on any antidepressants at all. I was when I started Wegovy. I am completely off of it. Like I don't feel that I need it. I'm no longer having days where it's hard for me to get out of bed. I'm no longer having days where I don't want to go out in public. I'm no longer having days where my anxiety is like through the roof and I'm like predicting like an apocalyptic event is about to happen type anxiety. Like obviously it's not rational, that's why it's anxiety, but that's what it was. And I mean, like I wouldn't brush my hair, I wouldn't brush my teeth, like I had like knots I would have to like spend hours trying to like brush out. And at this point, like I'm getting up, I'm brushing my hair, I'm brushing my teeth. I might not be like doing my makeup every single day, but I am up, I'm doing stuff, the house is clean, like things look good. Like I am doing so much better. There is the ADHD aspect of my mental health that we're still working on a little bit, but like the PCOS aspect, totally fine. Like I feel cured. I know there's no cure for PCOS, but I told my doctor at my last check-in, like I don't have a single symptom of PCOS anymore at all. Don't have hair growth, don't have acne, don't have depression, don't have anxiety. My hair quit falling out of my head. Like, it's still, like, I think it sheds like a normal amount, whereas before it was like clumps, like big, like I could do that and a clump would come out. Like, it's still kind of growing back, honestly. Like, I'm still very thin on top, but it stopped falling out. My nails are growing. That's crazy for me. My nails have like never grown ever in my life. I hope my hair starts to grow, because that's one of the things, like my hair has just always been really slow growing. I don't know if that's related to PCOS or not, but like the mental health is the main reason why I need to stay on this medication. I cannot go back. I didn't realize how actually terrible it was until I started like getting out of it. I started having hobbies again, started doing things more often, started spending more time with my friends, started being more involved with like my kids' school, started, you know, just like wanting to do all of these things that I never wanted to do before. You know, I don't cry as often as I used to. I would be crying like every single day for like no freaking reason, like just miserable. And I just thought that's how life was. I thought that's just how people are. I'm just overly emotional. I just feel too much. That's not the case, dude. It was my PCOS fucking with my brain. Like, I don't have any other way to explain it other than like, it's like being outside on a cold fucking winter night with no clothes on, and you have no flashlight, your phone's dead, and your car broke down, and you're in the middle of nowhere, versus like a nice summer night where you're camping with friends and you've had a couple drinks and your best friend is there and your husband is there and everyone's happy and like we're celebrating and there's fireworks. That's the type of difference. It feels like I went from like that cold winter night to like this nice summer camping night. Like that's my, I don't know, that's my like threshold, I guess, for depression. When it starts feeling like a cold winter night, that's when I need to get back on Prozac. I'm not on Prozac, I'm not on Wellbutrin, I'm not on anything right now. Nothing like mood stabilizing at all. And I'm literally just managing right now with diet and exercise. So, lost the 85 pounds. Would I do it this way again? No. I would still do a GLP-1, but I feel like I topped out at the max dose too quickly. I feel like I would have stayed on the lower dose for as long as I was losing weight, and then if I hit a plateau, then I would go up. What I did was I stayed on the lower dose for an extra month, but then I just kept going up, tapped out at 2.4, and I plateaued, and there was like nothing that I could do about it except for like get through the plateau. If I had been on like 1.0 at that time, I would have just gone up a dose and the plateau wouldn't have happened. But at the same time, I'm grateful that like I lost that last little bit of weight a little bit slower, because I do have some loose skin that I'm dealing with. I'm a 5-foot individual that's about this tall, and the loose skin, like it's not terrible, and I also have gone through a pregnancy, so I think a lot of it is from that. But it's just something that I don't like to look at, and I am still working on losing a little bit more weight this year. Once I hit 120 pounds, which is considered the upper end of normal for 5 feet tall, so I'm not like trying to be crazy or anything, but once I hit 120, I started maintaining, and I've stayed at 120. Over the holidays, I gained a little bit of weight. I've already totally lost it. I'm still at 120. Which with PCOS, if you gained a little bit of weight over the holidays, it would take you months to work that off. That was my dishwasher, if you heard that. I needed a little bit of time, like a little bit of a maintenance break, especially over the holidays. You know, you want to enjoy your favorite meals or whatever. Everyone always asks what my favorite food is, and I'm like, it's Thanksgiving. So essentially just maintaining. I'm at 120. I've been at 120, I think since like June or May, like of last year. So now that I am on this compounded one, the doctor that I am getting that from said, you're at the upper end of normal. Your stomach, my like waist measurement is a little bit like too high for what it should be at my height and weight. And a lot of that is because PCOS, you tend to accumulate a lot of like stomach fat specifically. And he said, it's not too bad, and it's probably improved. We don't have measurements from before, but my waist size is just a little bit big compared, like it's disproportionate for my weight and height. So my stomach is still just a little bit too big to be proportionate. And of course, everything looks a lot better in that general region at this point. Like I'm sure there has been a lot of significant improvement, but he was like, I think you should shoot for like 110 to 115, just see how you feel, and then go from there. So that's what I'm doing now. I have been for the last, I don't know, 5 days. I've been back on my exercise train. I've been getting 10,000 steps. I've been back on my diet train. Like, it feels a lot better now that I've had a little break. So one piece of advice that I would give is take maintenance breaks. Like, take a little break. It's a lot to lose that much weight, and it's trauma to your body. Like, your body will treat it like a trauma. So that time was really nice. I was able to do a lot. And like I said, I have hobbies now and I'm doing all this stuff, and like, I am happy with where I'm at. Like, if I didn't lose any more weight, I think I'd be okay. But I do want to look a little bit more proportionate. I do feel like I look a little weird. That's on me, not on anyone else. And obviously I'm extremely happy to be where I am now, because this is where I was before. At 5 feet tall, 205 pounds, if not more than that. I think the highest that I got was 250. That was during my pregnancy. But after I gave birth, I was down to 220. So I really, like, not all of it was pregnancy. Obviously, not all of it was pregnancy. So I'm happy with where I'm at. I am nervous to be going on a compounded one. I'm hoping that because it's compounded with vitamin B, I'm hoping that like gets my B levels up, because actually my vitamin B is pretty low. I chose a GLP-1, like TLDR, I chose a GLP-1 because nothing else was working for me. I had tried everything. Yes, I was scared to have to use a needle every week. Yes, I was scared about the side effects. I figured the worst thing that could happen is I have to stop taking it. You know, the worst thing that could happen is I'm nauseous and vomiting. As somebody who has that fear of vomiting, it was scary. It was scary. Of course, I got norovirus like shortly, like maybe 6 months after I started the Wegovy. And ever since then, I have not had a fear of throwing up. So I think exposure therapy does work sometimes. You still have to take Zofran, but very, very rarely. And it's usually my own fault. Like, if I eat something that's super high in like fat, not necessarily like healthy fats, but I'm talking like grease, like fast food, I will start to feel nauseous and I will take Zofran, because otherwise I probably would vomit. I feel good. And like at this point where I've maintained this whole time, I haven't lost anything. I have not gained, except for that little bit that I gained that I've already lost over the holidays. I think that right there is proof that like this isn't necessarily a magic drug. It's for PCOS. In my opinion, it's magic for PCOS. In my case, like completely anecdotal. However, I've been seeing a lot of studies about it and it does look promising. Like someday it may get FDA approved to treat PCOS. I really hope that that's the case. But like you do still have to work at it. And I do see a lot of like online discourse about like, oh, you're just taking the easy way out. And yeah, when you stop taking it, you're going to gain all that weight back and blah, 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 blah. And I'm like, yeah, the medication, you have to actually take your medication for it to work. And for me, I probably would gain the weight back because my brain is just like wired wrong. You know, it's not my fault. I have PCOS. Like, what do you want me to do about it? I plan to be on this medicine forever until I am ready for my second child. And while I'm breastfeeding, I will not be taking it, but like best believe I'll be getting right back on it as soon as I'm done breastfeeding. Like, it's like not even a question in my mind of whether or not I want to stop taking it. If I get pregnant, breastfeed, and am able to function without it, then yeah, no, I don't need it anymore. I won't get back on it. But I think it's a great tool. Like, would you tell somebody who has high blood pressure to stop taking their medication because it's the easy way out? Like, yeah, blood pressure can also be managed by diet and exercise, but you're not telling people to stop taking their blood pressure medication. I think a lot of times, like, if you have a weight problem, you most likely have another problem that's contributing to that. And for me, being on a GLP-1 has, like, taken that problem away completely. I'm no longer at the point where I was. I was so hell-bent on losing weight and trying to cure my PCOS that I stopped eating. I was starving. I don't even want to tell you how many calories that I was consuming per day because it is so far under anyone's recommended amount. And I wasn't losing weight even doing that for weeks. Like, I wasn't binging. I was starving and was not losing weight. I tried everything. Whole30, Paleo, Atkins. I tried everything. And nothing worked. This did. And I'm happy, like I said, happy where I'm at. Don't feel any need to go back to where I was. Mental health, like, is important. I said the mental health is really the most important thing for me. Like, I can deal with the painful periods, I can deal with the fatigue, I can deal with the nausea that comes from the periods, good lord. I can deal with the vomiting that comes from the period pain. I can deal with the lightheadedness that comes from the period pain. What I cannot deal with ever again is being that depressed. Never, ever, ever again. Will never happen again. You're not gonna see me down in the dumps like that ever again, like, for real. I am so much happier now, and I'm very grateful that I was able to get this medication covered under insurance for as long as I did. I am now paying out of pocket for the compounded version, which is cheaper, but still not exactly the cheapest. And that sucks, but it is what it is. Like, do you want to pay extra money every month for something that you need, or do you want to go off of it and potentially, like, go back to being so depressed you can't even, like, get out of bed or be a good parent? For me, being a good parent, very high on my priority list, if not the top of my priority list. So that's what I'm doing. But now I'm building muscle. I did lose a lot of weight, so therefore lost a lot of muscle. I was exercising, but nowhere near as much as you're supposed to because of the fatigue at first. The fatigue was, like, probably the worst side effect. And now I am back to working out, trying to build some muscle, hoping that it clears up some of that loose skin, and that's what I'm gonna go do right now while I have time. So I will be back next week. I'm gonna try and make it a point to do a video once a week, even though no one's watching them. I have this dog here who wants to be in the video. He's been fed today. So right now he just wants attention. And that's okay. We all want attention sometimes, don't we? I am going to go do my little workout for today. Right now my plan is 1 workout a day plus 10,000 steps. So like a cardio or a weightlifting like every other day, and then 10,000 steps no matter what. I've been using the walking pad quite a bit because it's freaking cold outside. So walking outside is like, I could, but why do that when I could be in my room, you know, watching a movie? I walked on the walking pad yesterday and watched Wicked 2, part 2. It was hella good. We'll be back next week. Say bye, Yuki. Say bye, Yuki. This is Zuko. He is the prince of the Fire Nation.